40s and you're suffering from anxiety or depression, or maybe you are already taking medications for anxiety or depression, have you thought about the role that hormones may be having on your mental health? So what do we know about this topic? So I wanted to share a few slides with you. So let's begin here. So this is from Cambridge University Press, a study from 2023, Severe Mental Illness and the Perimenopause. This is well recognized that things can really begin to go wrong during this time of hormone transition. We know that progesterone and estrogen are changing, and these hormones have a huge impact on the brain and the mental health and wellness of many, many women. So what else do we know? So we know that next, what are some things that we can do about it? So these are a part of the NICE guidelines out of the UK. So in the UK, they have a national base guidelines, and they're reviewed every couple of years. So this was 2019, and then they actually went and revised them. So this is just a little snippet that I've posted here. But when they talk about depression, in 2 randomized controlled trials, so 19 of HRT, they were associated with improvements in symptoms of depression compared with placebo. So what were they doing? They were giving women hormonal therapy compared to doing nothing at all. And they showed an improvement of the symptoms. So now in the UK, it's advised that hormonal therapy can be used as a treatment for depression during this perimenopausal transition. So again, one of the things is, let's just stop this one. One of the things is that most physicians aren't aware of the impact of hormones and really the role that it has to play on women's mental health. I know for me, when I went through perimenopause in the very beginning, I was having anxiety, palpitations, and then I did go through a time of a depression. And so much as women, we have it on ourselves to think that we're just not doing enough. We just simply don't recognize that as our hormones switch, it actually has a role to play up in our brain as well. It's been well documented. We have estrogen, progesterone, and testosterone receptors in the brain. You know, last year, Dr. Lisa Mosconi's work was great. She was actually able to identify these receptors. So as we go through this hormone transition, our brain structure is changing, the neurochemical balance is changing, and this can really have huge impacts on women's health. So what else do we know? So here in Canada, so this is a guideline from 2021 from the Journal of Obstetrics and Gynecology in Canada. And I think it needs to be revised, but what it does say that menopause can have a huge role to play on mood, sleep, and cognition. And the article actually goes on to say that it is very well documented that women who have early hysterectomies and that have premature ovarian insufficiency, this is early menopause, before the age of 40, are much more likely to have depression. So this article is 4 years old. So why are we not discussing this more and more within our fields of obstetrics, but also within our fields of psychiatry? You know, I see so many women that come in and they don't make the correlation that their mental health can be having an influence based on their hormonal health as well. And so the other study that I think I have here for you today is, again, a randomized a meta-analysis, a review of many journal articles, okay? So it is the psychiatry department in Australia. It's April of 2023. I just wanted to come up here with the date. And this is what they said. You know, basically, are women during the perimenopause developing depression and anxiety? And the answer is yes. They are having more depression and anxiety during this time frame. So we're talking about it. You know, these articles go back just about 4 years. So we know the information is out there, but what is being done? So really, women, I just want you to know you need to advocate for yourself, okay? Because we know that antidepressants, yes, they can have their role to play, they can work, but they can come with their degree of side effects as well. You know, several of my patients tell me that they've just been prescribed an antidepressant, but they feel flat. It's like their emotions are gone. And then they tell me when it comes to libido, that becomes flat as well. And that's really part of a woman's overall health. But what if having a discussion perhaps about hormonal therapy where you're actually, augmenting your system with natural estrogen, with natural progesterone, and you get a lot more benefits beyond the mood. You can have heart protection, you can have bone protection. Maybe we need to have more of this conversation in the whole mental health field. So I guess I'm putting a role out there for those of you that are in the mental health, whether you are a social worker, whether you're a psychiatrist, whether you're a physician that's actually working in mental health. Are you considering this with your patients? Do you think when a woman comes in to see you, are you thinking about where is she in her menstrual cycle? Is she having bad PMS? Or if she's in her 40s, maybe talking to her about her cycles. Are they changing? Is she having other symptoms that may not just be straightforward depression, but it can be that depression and anxiety-like symptoms that come because of the perimenopausal change? So I hope this has been helpful. If you have any issues receiving care, or if you have any comments with your healthcare providers, please drop a link below, drop any comments, and I'd love to hear them. And for those of you that want to learn more, please stay tuned on this channel. Know that I'm there for you. We did start the Wise Woman Rising program this week, and it was so wonderful to share with so many women. And next level is going to be starting in September for those of you that may want to join as well. Otherwise, have a wonderful day.